So hello and welcome. My name is Dr. Susanna A. Lopez, psychology postdoc here at the Nathanson Family Resilience Center, UCLA Semel Institute for Neuroscience and Human Behavior. This presentation was created by myself and Dr. Norita Milburn. We are excited to present on this subject in commemorance of the Homeless Awareness Week. Studies in this area have been very limited. We will be presenting on what we know from research as well as what seems to be going on locally here in Los Angeles County, based upon news reports about homeless youth. Homeless youth have been increasingly raising in the recent years. Nearly 2 million youth are homeless in the United States every year. Many return home, but a number do not. About 380,000 remain away for more than 1 week, and 131,000 remain gone for over 1 month. So next, we're going to talk a little bit about public policy and programs for homeless youth. Here are some suggestions for public policy as well as national legislations and programs that have the potential to impact youth homelessness. The NAEH proposes several programs and budgets, including to provide $2.4 million for HUD homeless assistance grants. This program funds rehousing programs, pays for enough new permanent supportive housing to end chronic homelessness. The next option is to fund all Section 8 housing choice vouchers renewals and $75 million for 10,000 new vouchers. This would provide affordable housing, which is a key component. It's essential to guarantee stability to all current voucher holders and to help more people that might be in need. Next, it would be to fund the National Housing Trust Fund. This will also help close the gap between supply and the need for affordable housing. The RHYA funds local providers to address the needs of homeless youth. There are several examples to this program. The Street Outreach Program would allow workers to go into the community, approach youth, and provide them with referrals and services. The Basic Center Program provides basic shelter and counseling services to reunify the youth with their families. And the Transitional Loving Program allows youth ages 16 to 21 to reside in housing for up to 18 months, while obtaining services such as employment, education, and mental health assistance. The HUD also funds many youth-specific emergency shelter, permanent supportive housing, and transitional living programs. So some of the challenges that homeless youth currently face are these. So research has shown that one of the biggest conflicts that they have is family conflict in terms of chronic conflict with their parents or caregivers. And as a result, they might decide to leave the home. Also, there's a high increase of physical violence, abuse, and neglect and trauma in homeless youth, inside the home and outside the home. So youth, as we can see, youth experience a number of challenges that contribute to them leaving or being forced out of the home. And of particular note is that an estimated 20 to 40% of homeless youth in various studies identify as lesbian, gay, bisexual, transgender, or questioning. And their non-acceptance of their LGBTQ status might be a factor to why they leave home. Moreover, the lack of sufficient services, shelters, affordable housing for homeless youth in general represent the current landscape of homelessness in the United States. Systemic risks include the foster care system and the juvenile and criminal justice involvement. So the foster youth are at high risk for experiencing homelessness. In fact, many youth who age out of the foster care experience an episode of homelessness within the first years thereafter. And involvement in the juvenile justice system is also a risk. Some homeless youth have been involved in the juvenile justice system prior to and after becoming homeless. The relationship between these two still needs to be further investigated. So let's talk a little bit about homeless youth here in the LA County. One of the projects we have recent data on homeless youth in LA County that was conducted by Children's Hospital in Los Angeles in collaboration with youth servicing agencies that further underscored the points that have been raised about youth homelessness. So a comprehensive needs assessment was conducted with homeless youth ages 12 to 25 who use services in the Hollywood area of Los Angeles. At that time, this area was focal because of the concentration of services and programs where many homeless young people could be found. The profile of the sample showed that many of the youth had an increased risk for being victimized and many had foster care histories. The mean years of homelessness was 2.8 years. They had increased risks for victimization, mental health problems, substance abuse, sexual risk, and educational difficulties. Again, they had significant family problems, as we mentioned earlier, and about half had child protective services involvement, whether that just be CPS or also the foster youth care system. So, yet homeless people, including youth, continue to be criminalized even after all of these barriers and factors in their lives. These include that they're usually cited for breaking the law for engaging in basic needs, such as sleeping or laying down in public spaces. Again, so some of the solutions that Los Angeles City has implemented currently has been the following. So in Los Angeles County, there are only enough shelters beds for less than 1/3 of homeless people. So 2/3 of the homeless youth are left on the street. In July of this year, the City of Los Angeles issued a new ordinance that is an example of the criminalization of youth in adult homelessness, wherein they can be ticketed or with a misdemeanor for leaving their belongings in public places. This new ordinance states that homeless people are to remove their belongings within 24 hours. If not, then they will lose everything they own, including their medications and documents, as their possessions will be impounded and returned once a fine is paid. Homeless people risk criminal prosecution and jail time if they resist the impoundment. This ordinance hasn't been enforced as of yet. Advocates believe this takes LA in the wrong direction and that it is not cost effective. Currently, $87 million of the $100 million per year the City of LA spends on homelessness already goes to law enforcement. That leaves just $13 million to actually help homeless individuals, and much of that goes to outreach efforts rather than housing and treatment. As a response to this ordinance, Sandy Banks, a journalist from the LA Times, states, that approach seems hard-hearted to me. Many are young and on the run from troubled homes. Most are addicts, alcoholics, or have signs of mental illness. Shouldn't we offer a hand instead of handcuffs? This is one perspective. However, as others, including home and business owners, note that this is the correct way to address homelessness and advocate for harsher punishments if the law is not followed. So let's give a real example. This might seem a little bit of an extreme example, but it's an example of situation here in LA this year. So the recent death of a homeless young man in Venice, California, which is part of the LA County, further illustrates the criminalization of youth homelessness. He was part of the Venice Boardwalk homeless family. His friends report that he had, quote unquote, a drinking problem, but that he was working his way out of homelessness by getting a job and making peace with his family. He had recent contact with his mother and was making plans to return home. Observers noted that he was spanging, which with his dog outside a bar when someone complained. He scuffled with police, was shot and killed by the police. Spanging is the street term for asking people for spare change. This young person was killed as an attempt to, quote unquote, restore order after a person complained about his presence outside a bar. So an important section that we want to leave you with is recommendations. So after knowing some of the statistics and some of the legislation recommendations and seeing that example of the young man being shot by the police, we say, now what? So these are some recommendations that we have based on the literature and clinical data. So making more funding available, of course, so allowing for the much needed programs mentioned earlier in the slides. 2 is ensuring federal programs are structured to maximize efficiency, that the funding goes to the appropriate people, so in order for it to be effective and accountable. And 3, invest in family interventions and reunification programs. So family interventions should be considered for early intervention, as family interventions have demonstrated to improve housing and additional outcomes, such as mental health, decreasing at-risk behaviors, and suicidal thoughts. And reunification with their families when it's safe to do so. Runaway and Homeless Youth The Runaway and Homeless Youth Act programs have strong focus on reunification and show success in reunifying youth with their families, which then allows them to come back home and end the cycle of homelessness. And then we also suggest affordable housing appropriate to the developmental needs of the homeless youth. This might include transitional living programs or permanent supportive programs. And older homeless youth ages 18 to 24 years who are transitional age can sign their own leases, access rapid rehousing, transitional housing, and or permanent supportive housing, which can include connections to education, employment, and supports to transitions to independent living as an adult. So we actually need more accurate data on homeless youth in order to scale resources and interventions. We need a large representation sample, ED, focusing only on street youth might limit the range of outcomes and limit ability to identify typologies. Also improving the child welfare response can increase overall efforts to prevent and end homeless youth. In addition to improving outcomes of youth exiting foster care, the foster care staff should also target family intervention services to the families of minors who are at risk for leaving or being removed from the home. Family services like counseling and adolescent development education can also help youth return home safely. So to end, we want to with this. We want to leave you with this quote from Jan Chavarsky, which says, "There is a lot that happens around the world that we cannot control. We cannot stop earthquakes, we cannot prevent droughts, and we cannot prevent all conflict. But when we know where the hungry, the homeless, and the sick exist, then we can help." Thank you.